Before we start, shall I let Paul and Gassan, if you'd like to just introduce yourselves, that would be great. Paul, would you like to start off?
Yeah, of course. Thank you very much, Vicky. Thanks, Gassan, and thank you everybody for joining. It's a pleasure for me to join you all tonight. We've done a couple of these webinars, and I always say I have so much admiration for all of you and everybody who works in the care sector and in social care, because you work so hard day in, day out, helping to support and protect the most vulnerable residents in our society throughout Southwest London. So pleasure to join you, and I really hope that you benefit from the webinar today. My name is Dr. Paul Riley. I'm a GP in Southwest London. I work in Merton across 2 practice sites. And for the last month and a half, I've been leading our Merton COVID-19 vaccination programme in care homes. So I know I know how important this topic is, and I can relate my experiences that I've had going to care homes and speaking with care home staff. Personally, I've had the COVID vaccine. My wife has had the COVID vaccine. She's 6 months pregnant, and I know a lot of concerns have been raised about pregnancy, and I hope we can discuss these perhaps a bit later on today. I know it's safe and I know that it's effective, but I absolutely understand that a lot of people have concerns and anxieties for some very good reasons. And what I hope I can do today with Gassan is to try and alleviate some of those concerns and give you honest information that you can trust and help you make informed decisions for yourselves about whether you want to go forward and have the vaccination against COVID-19. So that's the plan. There are no silly questions. I always say this. This is an open forum. You shouldn't feel embarrassed. You should feel this is a space where you can ask anything you want to, anything that's on your mind, and we will do our best to answer your questions. And if we can't, for whatever reason, then we will make a note of them and we will come back to you. So that's what we hope to achieve tonight, and I hope you enjoy it.
Thank you, Paul. That's great. Thank you. And Gassan, would you like to introduce yourself?
Sure. My name is Gassan. Thanks, Vicky. My name is Gassan. I'm a medicines pharmacist working with Southwest London CCG. I work across the Richmond and Kingston boroughs. The team, since sort of November, early December, has been actively involved in supporting the primary care network sort of vaccination clinics across our 2 boroughs, and also in collaboration then with across the whole of Southwest London. I've had my first jab as well. I had my my vaccine. I had no hesitation when it came to being offered. I was more than happy to. Completely felt safe taking it. I'm an asthmatic. I'm pretty certain I've had COVID because I've had all the symptoms early in March, but although I couldn't get tested, I had my antibodies tested, which said they were positive, which I guess confirms that. But I had no second thoughts about taking the dose. I mean, I'm sure other people have gone through experiences, and you've all been and seen different things, and I've had family members who have passed away through this. So for me to just even be able to be here and give a little bit back and be able to support other people through the decision is something I'm really proud to do. So thank you for giving me the opportunity, and thank you for everyone who's actually on the call today.
Oh, thanks very much, Gassan. Yeah, and there's personal experiences as well, so we're really grateful to have you on board too. Thank you. So we kind of entitled this session the Young, Fit and Healthy, because what we found when we were talking to some staff working in care homes and some staff working in domiciliary care or social care settings was younger people often thought, well, I'm young and I'm fit, I'm really healthy. Why do I need to have the vaccine? Why should I have it? Would I get that sick? So I guess maybe that's a kind of starter question for you, isn't it? Where we were coming from. Why, if I'm young and fit and healthy, why should I have it? They're not, the over 80s are going first. It's not the young people.
Yeah, shall I go first?
Yeah, sure. You go for this one.
Yeah, I mean, I think it's a valid question, and I think it's a good title of the webinar today, because I think quite a few young people are under the impression that actually COVID is a disease that only tends to affect older people, and that perhaps is the message actually that has come across sometimes in the media, and certainly in terms of the way the vaccine's been prioritised. Everybody knows that it's the older patients who are at the front of the queue. But the reality actually is slightly different, and many of us have personal experiences of this. It is absolutely true that if you are older, over 65, you are more likely to suffer severe illness with COVID, and you're more likely to die from COVID. But there are many, many patients throughout the UK and throughout the world who are young, who are fit, who are healthy, who have caught COVID and who have become severely ill. Many of these patients tragically have also died. And even if they haven't died, a lot of people we are seeing develop symptoms that last quite a long time after the initial infection. And so this is called long COVID. Most people do recover within a couple of weeks, but some people have been suffering for months and months and months with many different symptoms. And this can happen to young people just as well as it can happen to the older population. So there is no way of predicting whether you're a young person who will not suffer much with COVID or have no symptoms, or you're a young person who will die with COVID or will suffer symptoms for a long period of time with long COVID. So if you don't protect yourself, you're really rolling the dice, and you're saying, I'm going to take a chance and I'm going to risk it here. And given that we have a vaccine which we know is safe and is effective and can give you that protection, to me, it doesn't make sense to roll the dice on a personal level. And I'll give you one anecdote from me personally. About a year ago, just before COVID really became mainstream, became a big focus for everybody, I was working out of hours, and I encountered a young 18-year-old girl, and she had a cough, and it was a mild cough, and she was seemingly very well in herself. And if I hadn't examined her, and if I hadn't put a SAPS probe on her finger, which is a little piece of equipment we use to measure how much oxygen is circulating in somebody's blood, I never would have discovered that her oxygen levels were actually dangerously low. And she was sitting there in front of me. She was talking even quite happily. And at first I thought the equipment was faulty. And I took it off, and I warmed her fingers, and I put it on myself, and it was working fine. I put it back on her, and I said, I'm terribly sorry, but I'm going to have to go and get some oxygen. And I had to call her an ambulance. And I was really confused. I remember thinking, this is really weird. I haven't seen anything like this before, but I have to respond to what the machine or the equipment is telling me. And she needed oxygen for quite a prolonged period of time. And now looking back on it, I am quite sure that that's because she had COVID. And shortly after I encountered her, I had symptoms of COVID. I got a fever, I got a cough. My wife got a fever, she got a cough, she lost her sense of taste, she lost her sense of smell, and so did our daughter. So I think that particular patient is probably where I got it from. And that illustrates the second point really about why it's important that you protect yourselves. It's not just yourself that you're protecting, because you may catch COVID and you may have only mild symptoms. You may even have no symptoms, but you can pass it on just in the same way that 18-year-old girl passed it on probably to me. Now you can pass it on to your family, to your friends, to other people in the community, to the people in the care homes that you care for, who are probably the most vulnerable people in society and for whom this is a life or death issue, really. So all of those, I think, are really good reasons why, even though you may consider yourself to be young, fit and healthy, it's really important that you get vaccinated too. Protect yourself, protect your family, protect your friends, protect the people you care for, and protect your community.
Thank you, Paul. That's really helpful, isn't it? Thinking about both yourself, but also those that you're caring for. And Gassan, did you want to add anything?
I'd echo everything that was said. I would also, mention the indiscriminate nature of this virus, and the concept of thinking that you're younger and fitter and healthier doesn't follow. There's no pattern to this virus. There's no rule to who it chooses to hurt. Who in terms of, I heard recently that a friend of mine from university, 2 years older than me, without a known underlying condition, recently passed away from COVID-19. He was only 43. To me, he was young, fit, and healthy. And also looking at the hospital data over the last sort of weeks, you'll see the number of hospitalizations of younger people increasing. So it's definitely not a case of this doesn't affect the young or the fit or the healthy. This can affect anyone. That's the only thing I had.
Thank you, Gassan, and I'm so sorry to hear about the loss of your friend. It's really difficult, isn't it, when COVID it hits home when it's so close as that. So I'm really sorry to hear that. We've had a few questions come in advance, so we'll open with those, and two that are quite similar. So one says that if I am infected with the virus and have no symptoms, will I have had COVID? And if I'm infected with the virus and have minor symptoms, will I have had COVID? So kind of two people who've asked that question.
Yeah. So if you're infected with the virus, then yes, you have COVID. That by definition, if you're infected with the virus, you have it. Now, not everybody who has it responds in the same way. And I think approximately 1 in 5 people will not know they've got it because they won't even have any symptoms at all, but they've still got it. And the important bit then is the fact that they can still transmit it and they can still pass it on. So COVID is mostly passed on when you breathe out. Then you breathe out a lot of tiny little water droplets into the air, and the virus sticks and is attached to those droplets. And other people can breathe those droplets in, or they can touch their nose, their mouth, or their eyes, and that's how the virus gets into your body. Or those droplets can land on surfaces, and people can transmit the virus from surface to surface onto your hands and then to your mouth, to your eyes, or your nose. So even though you have no or mild symptoms, if you have COVID, you've got it and you can transmit it. That's the important thing to remember.
Thank you. And I think building on that, and our first question was, if most people who contract the virus have mild or no symptoms at all, then why get vaccinated, and why aren't they just vaccinating the vulnerable?
I think that just refers to a lot of what Paul had already discussed about why it's so important to get vaccinated, in terms of, you not just for your own personal risk of exposure and risk of illness and severe illness or risk of long COVID, but it's also to the people around you, the family, your friends, colleagues, patients that you're caring for. We mentioned the indiscriminate nature of this virus. The vaccine is there to protect you from serious illness, potentially death in many cases. And for that reason, it just, for me, it's a no-brainer why we would take the vaccine if offered.
There's another point to mention there, which is worth thinking about. And that is that, again, even if it gives you any mild symptoms or no symptoms, if the virus is transmitted to enough people and enough people become severely ill, even if it's not you or your age group, those people are being admitted to hospital in huge numbers. And what that means is all hospital care slows down, and in many cases, some hospital care is shutting down because the hospitals are completely overwhelmed. I've never known us to come as close to hospitals being completely full in this country as we were maybe 1 to 2 weeks ago. Things look like they're starting to improve, but you still have extraordinary numbers of people in intensive care beds, which have been created rapidly over the space of sometimes days, as hospital intensive cares have expanded in size to cope with the volume. Many people's operations have been cancelled. Many people's operations have been delayed. Many people have been waiting for all sorts of health reasons, completely unrelated to COVID, to see appointments and see specialists, and they now won't be able to do that for a long, long time. And if the hospitals become completely overwhelmed, then nobody can get any health care that they need. And that affects us all, because we all at different stages of our lives are vulnerable to suffering from various diseases and illnesses. And so people may think, well, COVID is not affecting me directly. It may not be, but indirectly it will do if care that you need at the time that you need it is not available because the healthcare service is so focused on COVID care.
Thank you, Paul. That's right. Again, going back to that point about the sort of wider system as well. We had a question come in. So someone says they've had COVID and they still have antibodies from the previously having COVID. Do they still need to get the vaccine?
Yeah, that's a really good question, and that's something that quite a lot of people ask, and it's a really sensible question, because you may think, well, I've already got the antibodies. Why do I need a vaccine to tell me to make any more? And there's 2 points I'll make, and then I'll ask Gassan to add his experience as well, actually, perhaps. But the first thing to say is nobody is entirely sure how long those antibodies from infection will last and how long they will give you protection for. Certainly, there's plenty of anecdotal evidence, and I know somebody who has caught COVID twice. So they got it once, they were unwell, they produced antibodies, they got it again 4 or 5 months later in this case, and the second time they got it, it was much worse, in fact, than the first time. Okay, so having the antibodies from first infection doesn't necessarily protect you that much, and we don't know how long that protection is going to last. And also, having antibodies and being protected for infection are 2 slightly different things. Just because we can take a blood test and see that you've got antibodies in your blood, it does not necessarily mean those antibodies are going to be that effective against COVID if it were to appear once again. What we can definitely say is having the vaccine will give you extra protection, will give you more antibodies, and will make you less likely to catch COVID once again, and less likely to suffer severe illness if you do. So even if you've had COVID and you had antibodies, I strongly recommend that people do take the vaccine.
Thank you, Paul. Gassan?
Yeah, I would only add that it was a question that came. It was a personal question, because I knew I was about to go out to potentially support in the clinics for the vaccine, and I was able to test whether I was positive for antibodies. I was, but after doing my research and just checking, I mean, the advice was to still have a dose. I mean, the antibody strengths were, it's not clear how strong the antibodies are, how much longer they'll last for. And it was, for me, it was a very easy decision to make, to have a almost what it felt like a booster. So it was almost like keeping me stronger for longer. But also I know couples who have both had COVID, and after a few months, one of them has antibodies and the other one doesn't. So it's even if you get antibodies at the same time, it doesn't necessarily mean for individuals you've still got antibodies for any length of period that you can predict. It's just all kind of known concepts, as what Paul alliterated on.
Thank you, Gassan. Yes, some good points to consider there. I just saw a comment come into the chat. This is more about the process. So Babu Huringnag, I think, sorry if I'm mispronouncing that. I am sorry that you haven't been able to get your appointment as yet for a vaccine. Dave Williams has put his email in there. He's the project manager overseeing it. If you're happy to email him directly, he can organise you the booking link for that immediately, or if you prefer, you can put your email into the chat. And great, thanks Babu, that's great, you've sent it to Dave, brilliant, so we can get that sorted for you quickly. Thank you. So an interesting question that we had come in was somebody in advance, and somebody has asked, what's the difference between SARS-CoV-2 and COVID-19? And then if someone is tested positive for SARS-CoV-2, are they already immune to COVID-19?
So, shall I take this, Paul?
Go for it, Gassan.
So yeah, it's an easy question to be confused by, because actually people will mention SARS-CoV-2, or they'll mention, or COVID-19 tends to be the word used for the whole thing. which tends to be the easy way of thinking about it. And effectively, SARS-CoV-2 is the name of the virus that's being transmitted. The reason it's called SARS-CoV-2 is because of the SARS is the severe acute respiratory syndrome, which is sort of an indication of what kind of virus condition it can lead to, illness it can cause or lead to, as well as we know now many others. But also it's got the 2 because we had the original SARS-CoV virus in 2003. So that's where it gets its name from, for a particular class of coronavirus. The COVID-19 is actually the disease that's caused by the virus. So the disease infective rate that we've got as a result of the virus is the COVID-19. So the difference is one is the virus and one is the disease caused by the virus.
Thank you. So if they've tested positive for SARS-CoV-2, are they already immune?
Well, this goes back to the question about the antibodies previously as well. So again, the concept of any sort of serious infection like this, if your body would create some form of immune response and potentially have some antibodies, at what strength we're unaware of, or for how long they last for, which is why we advise that the uptake of the vaccine is sort of the way forward, because in theory, yes, you'd have some form of protection, but for how long and for how strong it is, we couldn't say. There isn't enough information or data out there to suggest how long exactly.
There is, just to follow up on that, Gassan, a related point which some people may be aware of, which is if you test positive for the virus, I'll call it COVID-19, so I think that's what people are most familiar with, and it's a bit easier to say than SARS-CoV-2. But if you test positive for COVID-19, then you may know there's a recommendation not to receive a vaccine for 4 weeks, at least 4 weeks after you test positive. Now, that's not because receiving a vaccine would be dangerous in that period of time. There's no evidence to suggest it would be dangerous. And if you did accidentally get vaccinated within 4 weeks of a positive COVID test, it's very likely that no harm whatsoever would come to you. But the reason why that 4 weeks is recommended is because we know that when you get infected with COVID-19, you can actually appear to be quite well for a period of time. Typically, up to about 2 weeks, you can appear to be okay. And then within that first 2 week window, all of a sudden, some people tend to deteriorate quite rapidly and they get sick quickly, and they might develop a fever, severe muscle aches, chills, joint pains, and they may then need to be admitted to hospital. Now, some of those things can also be side effects of vaccination. So if you tested positive for COVID-19, and then you had 1 week later the vaccine, and the next day after having the vaccine, you started to get a mild fever, which can happen, or you got some muscle aches, nobody would know whether they were side effects of the vaccine or whether actually your COVID infection was deteriorating and you needed to go to hospital and be treated more urgently. And we would never want to miss somebody who is deteriorating and getting worse and attribute their symptoms to vaccination and therefore delay support that they needed. And so for that reason, because we don't want to mix up, is this a side effect of the vaccine or is this COVID getting worse? That's why that 4 week window is inserted there. And that's why we say, if you had a COVID positive test, don't get vaccinated for 4 weeks.
Thank you, Paul and Gassan. That's really helpful. We've got a few more questions that came in advance, but I can see Charlotte's got her hand up. Charlotte, would you like to ask a question directly?
Okay, thank you, everyone. Yeah, I just want to ask them some questions because I'm one of those that have really been like double-minded about the vaccine. One, we know that there are mutant strains of this COVID-19. The present vaccine, is it going to also be able to take care of the different strains or the different mutants of the COVID-19? My second question is,
Charlotte,
African...
are you able to ask that question again? Because sorry, we just lost you slightly.
I think what she asked was, there's different strains, isn't there, and mutations coming out, and will the vaccine protect against the new strains? Is that right, Charlotte?
Yes, thank you very much. Okay, my second question is, I'm from African descent. I don't know if this vaccine has been tested on people of my color, and how safe is it? Then the other one is, how long is the protection? Like, for instance, we take flu jab every year. Is this vaccine a one-off thing, or is it going to be repetitive with time? And then I also want to know the long-term side effects of this vaccine. What is the long-term side effect? Sometimes you may take something and you may not see the effect. After some years, you start seeing the effect. I want to be clarified about. Thank you.
Thank you. So a few questions there, and I think a lot of people will be interested in that. So shall we start with the first one, was around the mutations. So we've got lots of variants and mutations coming out. Will the vaccine protect against those?
Yeah, so that's a really good question, and something that a lot of people are concerned about at the moment. Obviously, we've seen slightly different variants of COVID-19 emerge in different places around the world. And also we know there are some different strains circulating here in the UK. To the best of our knowledge, the vaccines that are currently being offered will give you protection against all of these known strains. It is not clear whether they will give the same protection against all strains or whether some will give better protection against one than another. But the scientists do believe that all the vaccines that are currently offered will provide some degree of protection against all the strains that have been identified. And therefore, at the moment, we would advise everybody takes up the offer to be vaccinated with a vaccine at the time that they are offered it, to give them protection as early as they possibly can, rather than waiting to see what happens. Because at the moment, we believe that every vaccine that can be offered will provide protection against variants. And even if in the future the virus mutates and changes so that some of the vaccines are ineffective, the scientists are already working on, and have been working for some time, on changing the vaccines a little bit so that they can offer protection in the future were the virus to mutate. And if that happens, then I would think those vaccines would be rolled out in the same way that these ones are. So we don't want anyone to miss out when vaccines are here and ready to use. And my advice would be to take the vaccine when it is offered to you.
Thank you. And then the next question Charlotte had was so about the testing of the vaccine. And I think a lot of people have been worried about, one, the speed at which it has been developed, but she was also saying she's from a BAME background. Has it been tested on people from BAME backgrounds?
So in terms of just generally the speed of the vaccine, I think because obviously we had a global emergency for a vaccine, sort of all the priorities of scientists, drug companies, governments, all, the priority of all these different cohorts, as well as many others, all was focused on producing a vaccine for this virus. We've learned from previous sort of SARS virus as well, in terms of being prepared to be able to act quicker. The technology for vaccines improves all the time, and also all the phases. The phases of the phases of the trials for a vaccine in this scenario haven't been left out. But what's changed is they've removed all the delays that happen in between, and sometimes there's been a slight overlap in some of the phases. So the speed does seem like out of context for any normal vaccine process, but it's all been done in the right sort of patterns. But they've cut out a lot of red tape, they've cut out a lot of delays, they've cut out a lot of sort of meetings in between that you tend to have, or discussions. Funding has been no issue in terms of trying to get everyone on board to support this process. And even for our own medicines approval agency, the MHRA, they worked around the clock at a fast speed to get this approved. They've done all the safety checks. They've done all the they've looked at all the data, the clinical, the non-clinical data, and come to their assessments that yes, these vaccines are safe and we can use them. In terms of who they've tested it on, they have tested it on a wide range of different people from different parts of the world and different areas of the world. So in terms of being concerned about sort of Black and Asian and a minority ethnic, they have tested people from different backgrounds, and the safety is the same for all individuals. I'm from an Arab background. My safety data is the same as the safety data for anyone in terms of the efficacy of these vaccines, and the efficacy in terms of the effectiveness of these vaccines from dose 1 is high. After about 2 to 3 weeks, the evidence shows that the protection levels are high, and yeah, that's really all I have extra. Paul, do you have anything else on top of that?
No, I mean, I think he summed it up really, really well. And I think it's just really important people know that no steps have been skipped and no corners have been cut. Exactly as Gassan said, everybody involved in the process of producing a vaccine, all at the same time, came together and had the same priority. And that's one of the reasons why these vaccines were able to be produced as rapidly as they were. If you can imagine, in normal times, if you're trying to produce a vaccine, there were maybe hundreds of other companies also trying to produce a vaccine, and you will apply for your approval for one step of the process, and you might be 99 in the queue, and it may be months, years even, before your proposal and your results are looked at and analysed, and you can move to the next stage. Well, at every step here, the COVID vaccines were number 1 in the queue. And that's one of the reasons why we were able to produce them so rapidly. The other thing to bear in mind when somebody says, how did you produce this in a year? It's not really been a year, because actually the vaccines are the end product, but an awful lot of the science behind the vaccines that's gone into making them has been going on for many, many, many years. In particular, I know for the Oxford vaccine, they had been producing their process, and they were almost waiting for something like this to happen, and they were ready to go when they realized that a pandemic was on its way, because of years of previous preparation in anticipation of an event like this. So it's not quite true actually that they've gone from scratch to vaccine in a year, and it's just been a phenomenal effort from many people, not to cut corners, but to do everything with the same degree of scientific rigor that it's always done in the UK. The same process has been applied, the same safety rules have been applied, and actually it's an outstanding achievement, and we're sure that it is safe.
Thank you, Paul. And I think this that's really helpful, because I think there's a question that's come into the chat that links into the next question that Charlotte had asked, because Charlotte was asking around the side effects, and I think building on both of these, Sudesh is asking, how long was the observation time for people who volunteered for clinical trials in the 9 to 10 months that it was produced, and is that a long enough time to rule out any serious side effects, or people who suffer major side effects will be referred to as in 1 in a million? He said, as in you'd have to deal with it on yourself. So I think there's kind of about the side effects, and just concern again about the time taken. Is that long enough to pick up on long-term side effects?
Yeah, I think that's a good question, and my answer, I think, would be to say that people are actually still being followed up. So it's impossible. Obviously, it's impossible to look at side effects longer than the time that's elapsed since the first vaccine trial was ever started. It just can't be done. But you can look back at similar trials, and you can look back at history of vaccine production, and you can say with a lot of confidence that actually, we haven't up till now observed any severe persistent side effects at all in any of the over 55,000 people who took part in the trials that have been attributed to vaccine. So I don't know offhand precisely when the trials began and when the first volunteer had their first injection, but it's approaching a year. And so what we can say is we have almost a year's worth of experience, and despite all these people in the trials having had the vaccines, and now real life, so-called real life experience as the vaccine has been rolled out, not just in the UK, but around the world, there still is, as far as I'm aware, no significant, serious, persistent side effect that's been attributable to the vaccine.
Thank you, Paul.
Just to sorry, quickly to add, I mean, I would say all vaccines can give side effects, and the most common ones you experience with any vaccine are very sort of mild, sort of local things. Sort of you might get a pain or a bit of tenderness in the arm, or a slight headache, or you might feel tired, or in these things, maybe even slightly feverish for a couple of days. You need some paracetamol. I had a few I had some pain in the arm and slightly exhausted after my first dose, but all these sort of all the data from the trials, all the data since the vaccines have been rolled out internationally, and we're talking obviously 10 million plus in this country now. We're talking multi-millions across the world, and all the data seems to be really positive in terms of safety. And historically, yes, in terms of vaccines, major incidents are extremely rare. I mean, you'd be pushed to find sort of major incidents when it comes to vaccines in general.
Thanks, Gassan. And I think that's a good point to bring up, because one of our viewers today has raised that, because he said that people have accused social media for spreading false news about the vaccines, but he's referred to the Tuskegee syphilis experiment, Pfizer paying compensation to families in Nigeria for a meningitis drug trial which killed a number of children, 2 French doctors discussing live on French TV to go and do COVID vaccine tests in Africa when it was spreading in Europe. And he's kind of pointed out this has created an immense mistrust for vaccination processes, which have to be addressed in the persuasion of people of colour to vaccinate. I don't know if you would like to just comment on it, because I think that's very good points he's raised, isn't it?
Yeah, I think that is a very good point. And I think it's very difficult when you look at social media and you follow information on social media. Very often information is shared with good intention, the best of intentions. And there's absolutely no doubt that if you look historically, there have been some unethical practices that have taken place. And you can find numerous examples of medicines trials where harm sadly did occur. I think the important thing from these vaccines perspective is that if harm is going to occur, and if significant harm is going to occur, it is likely that it would be picked up in the trials, and that's actually what the trials are there to do. They're there to ensure. They're called trial for a reason. When you start the trial, you don't know, nobody is sure, but you stop the trial basically when you have enough data and you've got enough evidence from the participants to be able to say confidently, yes, I believe this is safe. And so that's what has happened here. And normally if something is going to go wrong, and if you are going to get serious adverse effects, you pick that up at the trial stage. And that comes out in the data, it comes out pretty early. And historically, when this has happened, I'm going to say it's tended to happen in the private sector, where information has not been shared, perhaps for business reasons, and things have been covered up and they've been less than transparent. Here now, in terms of global pandemic, there's been a huge amount of information sharing, and the trials have been run in a very transparent fashion. And certainly in the UK, our safety tests and our standards and our scrutiny is exceptionally high. So for all those reasons, I trust the data. I trust it's safe. As I said, people are still being observed, but it's extremely unlikely that 1 year in now, really, suddenly severe side effects are going to appear that have not been noticed up until now.
Thank you. And then the fourth question that Charlotte had put across was, how long will the vaccine protect us? She talked about how the flu vaccine is an annual vaccine.
So the actual answer is we are still trying to find out more about how long the protection lasts. We obviously had some information yesterday from AstraZeneca about their vaccine, about how long the initial dose can protect, at what level of protection might be available, and each vaccine that's out there at the moment will provide a high level of protection from about 2 weeks onwards after the first dose. It will just be continued monitoring, continuing to look at the data, and we'll know more in the long term about how long the actual vaccine protects us from. The idea of the 2 doses being separated is one that we, from the first dose, build up a high level of protection and protect more people, and then the second dose is, in a form, the booster dose, the one that gives you that final push of immunity, so it boosts your protection and prolongs your protection. But in terms of what the future looks like, in terms of whether we'll be getting a vaccine every year like the flu, or whether we will have it combined with the flu, or whether it will be a separate, in terms of time, and all that is still information to be studied and looked at. I mean, they're even looking today at mixing vaccines and studies on that and what that effect might be in the long term. But in terms of what that looks like, we're all waiting to find out more as well.
Thanks, Gassan. Thank you. We've got a few other questions that are coming in advance, but it might be useful now we can just take a moment to talk to Erik. Erik has had COVID and he's very kindly agreed to share his experience here tonight. So Jiggy, were you happy just to have a chat with Erik and let us share his story for sort of 10 minutes or so?
Yes, thank you. Thanks, Gassan and Paul as well, and Vicky. I wanted to concur with you as well that all these trials have been run simultaneously as it's a worldwide pandemic. Everybody's just kind of pulled in together, all efforts together, and worked to get this done, so that we've not had to wait one after another. So there's been all these different companies doing it all at the same time. So that's another reason as well why it's come out faster than it would usually take. Erik, are you available?
Hi, can you hear me?
Hi, Erik, how are you?
I'm fine, thank you. Thanks for having me again. Thank you.
You're very, very welcome. It's lovely to see you. You're very welcome to put your camera on if you feel like, or we can talk to you without, however you feel comfortable.
Yeah.
Nice to see you, Erik. So I just wanted to ask you to share with the audience your story and what happened and how you got COVID and your experience of when you did get it. Are you able to share with us a bit about that and a bit about yourself as well?
Yes. Good evening, everyone. My name is Erik. My background is I'm a registered nurse. I'm currently working as a deputy manager in a care home in South Croydon. So I contracted COVID end of March, and immediately beginning of April, I deteriorated. And a friend of mine took me to A&E in Princess Royal Hospital here in Bromley. And immediately they took me to a resuscitation unit because my oxygen saturation was dangerously low. They gave me some oxygen, and they were struggling to raise my oxygen level. And from resuscitation unit, I was sent to critical care unit, and that's when I was given a CPAP. It still didn't help with my oxygen level, and within the span of 4 hours.
Sorry to interrupt, Erik. Are you able to explain what CPAP is for those who don't know?
A CPAP, sorry, I can't remember the acronym. The kind doctor might be able to. It's as a nurse, I can't remember what the acronym is now. Got brain.
I can help you out, Erik, if you want. It may help people understand what it is as well. So C is for continuous, P is for positive, A is for airway, and P is for pressure. So continuous positive airway pressure. And that's what we shorten to CPAP.
Thank you, Paul.
Thank you, Paul. So within the span of 4 hours or 4 to 6 hours, I was immediately sent to ITU, and I was put under medically induced coma, so they can intubate me and they can attach me to a ventilator. So 5 days in Princess Royal Hospital. I was still deteriorating, and they made a decision to contact King's College in Denmark Hill for the ECMO team. And so they went to see me in Princess Royal Hospital. They inserted a huge tube in my neck and attached to the ECMO machine, which is the extracorporeal membrane oxygenation. I was diagnosed with severe COVID pneumonitis. It's only 90% of my lungs. 90% of my lungs were severely infected. That's why my lungs weren't functioning. Whilst I was in ITU, I had acute kidney failure. So I was attached to a dialysis. So I was in coma for 4 weeks. When I woke up, I couldn't move, I couldn't speak. I had tubes everywhere. I was being fed through a tube via my nose, nasogastric tube. I had catheter on. I had arterial line, central line. I was being hoisted. I couldn't walk. And that's how it affected me. And, when I was in hospital, it was scary, really, really, really scary.
I can imagine.
Yeah.
And all the symptoms and everything that you'd been through and the procedures that you'd gone through, it sounds like a lot that your body and you yourself have been impacted by. And then are you able to share with us how else? So you're saying that it's impacted you physically in so many ways, and then obviously you woke up after your coma and you were still being fed through a tube, and then you had to learn how to walk again. And how else has it impacted you?
It impacted me in so many ways I can imagine. I mean, impacted me, financially as well, because I wasn't able to work. I work for a private company, and so I don't get sickness pay as the NHS staff. Although they put me on furlough, but I did struggle with some of my bills for a long time. And whilst I was convalescing, I lost my dad last year as well.
Yeah.
And I couldn't travel because of the ban on the flights. And also, I was still very weak. I couldn't even walk properly when I lost my dad. And
it's really difficult to go through when you're unwell yourself and you can't reach out and you can't go to see your family and be there with them, when firstly you've been through something so major, and then you on the other hand also you're going through something major with the impact of your father's death. So I'm really sorry to hear that had happened as well.
Well, that's how this pandemic affected me and so many people. It's not just physical, financial, everything, psychological. I'm still up until now. I'm still struggling with stress. So I've been diagnosed with what they call post ICU trauma. Or PTSD. I'm actually currently under the care of a clinical psychologist for counseling.
Yeah.
Because when I went back to work, albeit I'm not 100% very well, I just needed to go back to work because I'm passionate about my work. I'm passionate about my nursing. I need to support my staff, being a nurse manager.
Erik, you said you were part of a support network, which has been absolutely fantastic to share, and you've met lots of people through that as well, who have similar and different experiences to you as well.
Oh gosh, yeah. So the support is actually it's a Facebook group support team. It's called COVID Survivors Support Group for UK and Ireland. I joined the support group as a means of getting a support, and at that time I don't know what support I can get, but it's so amazing and how many people of different ages was affected by COVID, because at that time I thought it would be just for the over 80 and overs, and I was 42 then, and I had mild asthma. Yeah, I'm overweight, but I've never been really ill. I've never been sick. I've never been off sick from work. I'm a workaholic person. I always get myself busy, and when I joined that group, I was so surprised how the COVID survivors were getting younger and younger and younger. And I've been in that group for about 7 months, and because I'm following the group every day, the age group is even actually going like in their 20s and even in their teens. So everyone is really affected, and no matter how ill you are, or if you had a mild symptoms, or whether you were in coma, the after effect, and if we all survived the after effect, that we're all the same. We show the same symptoms. We have long COVID symptoms.
I know you've shared that they're getting, that you've seen and you've noticed they're getting younger. I also wanted to ask you another question that might be quite relevant as well about the vaccine. So I know obviously you said you contracted it early on last year, and at that point, if you were offered the vaccine and it was available, would you have taken it then?
Oh, definitely. When I heard about the COVID, the virus, I armed myself back in January. I did disinfect the whole flat. I bought a lot of disinfectants, alcohol gels, alcohol sprays. I didn't go out, just work, and then I go straight to my flat. And even then, I still got COVID, and I don't know how I got the COVID. And if it was available then, I would be first in line. I wouldn't even blink. I would just take it. Yeah.
And now that you've been infected with COVID, would you have the vaccine now?
I've already had the vaccine. Was it 3 weeks ago? So I'm waiting for my second dose. When I was back in August, I was contacted by the National Blood Service to donate the convalescent plasma. Mm-hmm. So I've been donating convalescent plasma like 5-6 times, and each time they check my my antibody levels.
Yeah,
it's always on a higher range, and for 6 months it's been on a higher range.
Okay.
And I asked one of the ICU consultant in King's College, should I get the vaccine? And, because I still have the high antibodies. And he said, yes, I should, because there's no guarantee that my antibodies will protect me from another infection. So, I was so scared of getting another one, because I always tell everybody, if I get another one, I probably wouldn't survive. That's why I took the vaccine 3 weeks ago.
And that's really important to share, Erik. And thank you so much for sharing your story and kind of the way that you've explained it to us as well. it's really, really powerful, and I'm sorry to hear of your loss as well. I'd like to share with everyone as well that you can experience very you can either be asymptomatic, you can have mild symptoms of COVID, but you can also have a very bad experience, such as what Erik has had, and you never know your luck, really. You never know how you're going to be impacted. So hearing a story like Erik is really important, and thank you for sharing your experience.
Yes, thank you, Erik, and thank you, Jiggy. I did see Paul popped his hand up partway through. Would you like to ask something of Erik? Oh. You're just on mute, Paul.
There we go. Yeah, Erik, thank you so very much for coming and explaining your story, because it's very, very difficult to actually fully appreciate or understand what can happen if you're infected with COVID, unless you've actually experienced it or you've heard firsthand testimony like that, which you just gave us. So really appreciate hearing it from you. You answered a couple of my questions as you continued speaking, which was great. But I think the only comment I would make, tragically, and you will notice, Erik, through your survivors groups, the tragic thing is that you're not actually a particularly unique case. That's what's so sad about this. Coronavirus is a devastating virus. It's related to the cold virus. Cold virus is a type of coronavirus, but the cold virus does not do to your body what the coronavirus does. And many people sadly have suffered the same way that Erik has suffered. And you can see, Erik, it's going to take you a long, long time. I'm sure you know, to really feel that you're fully recovered from this, and you're still struggling with some aspects of the infection now, nearly a year on. So it can be devastating, and I think it is important people recognise that, and realise that. So thanks for coming and sharing your story with us.
Yeah, thank you. Thank you, Erik. And we've got a couple more questions that have come in advance, but I think one point in the chat that would be good just to reflect on, and then if we open the lines, I realise we're just on 7:30 now, but there's always lots of questions, isn't there, for people? But yeah, Sudesh raises a good point, and that he says you can't sue Pfizer or Medina, and by extension all vaccine manufacturers, if you have severe side effects. And that the government is unlikely to compensate you. And he's saying, do we sort of realise, in our opinion, that this bodes well for any confidence, especially people who hail from developing countries where there has been incidents in the past and unethical practice. And he's sort of commenting, how can we see how deep-rooted uncertainty or complete refusal to vaccinate in BME groups could exist?
Yeah, I think you make a number of points there, Sudesh, and I think I'd start off answering that question or series of questions by saying it is everybody's own personal decision as to whether you take the vaccine or not, and that's a really important point. And it's been very, very important when we've gone into care homes as well, in particular, where some residents, unfortunately, because they have mental illness, are unable to make their own minds up. And we think really hard and really carefully about what the right thing is to do for that particular patient, that particular resident. And we speak to family, we speak to next of kin, we speak to lasting powers of attorney, and we try our best to make sure we do the right thing for that person. But it is everybody's individual decision. Nobody is pressuring anybody to take the vaccine. So that's a really important first point, I think. When it comes to the BAME community, the difficult thing to witness is that we know for some reason, if you are Black or Asian or from minority ethnic background, you are more likely to get severely unwell if you get COVID, and you are more likely to die from COVID. We don't fully understand the complex reasons behind that. It may be partly genetic, it may be because other diseases are more prevalent in those groups, which make you more likely to suffer from severe illness if you contract COVID. But the fact that you're more likely to get ill and more likely to die makes it even more important that you are vaccinated than other people who are not from those groups. However, when we look at the data and we look at vaccine uptake, we know that people in those groups are actually less likely to make the decision to get vaccinated. And that's a conundrum. And therefore, it's really important that we understand why. That's crucial, because if we understand why, then we can help people address their fears and address their concerns. And ultimately, the decision that everyone individual has to make about whether to take the vaccine or not should be based on data, and it should be based on science. It shouldn't be based on monetary concerns. It shouldn't be based on whether you can sue X, Y, or Z if something goes wrong, because that has absolutely nothing to do with whether the vaccine is safe or whether the vaccine is effective. And what the data shows is that nobody has suffered severe long-term side effects from vaccination at all. So, Sudesh, when you say if you have severe COVID vaccine side effects, nobody has thus far in all the 55,000 people, more than 55,000 people in the trials, and then all the people around the world who have been vaccinated to date. 10 million people in the UK now. It's an extraordinary milestone that was just reached. So you are very, very unlikely to suffer any. Nobody has. And it's important people know and understand that and make their own decisions about whether they want to have the vaccine based on the facts.
Thank you, Paul.
Just to quickly add to that as well. I mean everything Paul said spot on. And from my own experience, from my own family background, from my own community, speaking to friends who are doctors who are Ghanaian as well, who have got their own community, who have had similar sort of discussions. We've had all these discussions over the last few months about would you take the vaccine, would you not take the vaccine, and the consensus among everyone is the most important thing is the informed decision, not to follow what's happened in the past and what's happened in historical sort of measures is things that we have to learn from and never go back and do again. And what we do now is we look at what's in front of us right now, and we look at the risk versus the benefit of having the vaccine against actually having the virus. And the evidence stacks heavily in terms of, taking the vaccine. I've seen people change their mind instantly when they've seen a friend or a family member either suffer significant illness or pass away. And it's amazing when the same people I knew at the beginning of the sort of talk of vaccine and processes, when they were saying, oh no, this is far too quick, how are we going to have a vaccine? The same people are at the front of the queue when they've seen actual harm and illness and death to people around them. And these are the same people who have had these previous experiences, or whose communities have had previous experiences. So yes, I mean, it's an individual decision, but there are informed sort of resources, reliable sources and healthcare professionals you can speak to, and forums like this which will help.
Thank you very much, and I think it's really helpful to bring these issues out into the open. So thank you, Sudesh, for bringing it up, and I hope it sounds like you're kind of trying to be an influencer and support your community. So I hope some of this feedback that you've had will be helpful. There were one or two other questions that went in advance, but I realised we'd just gone past 1:30, and I thought I'd allow people to just unmute their phone lines if anyone did want to ask a question before we kind of draw ourselves to a close. Would anyone like to ask a question? I haven't got anyone speaking up. If you do have anything, please just start speaking, because I can stop. Sometimes it does take a minute to come off, a few moments to come off mute. I'll just ask these last few questions that came in advance. A bit more specific. So one was around somebody who they suffer from Graves' disease. Should they let their doctor know before they take the vaccine? And then their endocrinologist is waiting to see if so another person, if their upcoming blood test on the 15th of February for hypothyroidism has finally settled down after last year's nuclear medication treatment, is it safe for them to take the vaccine? So someone with Graves' disease and someone with hypothyroidism.
Yeah, so Graves' disease is what's called an autoimmune condition, where your immune system mistakenly starts to attack your thyroid gland, and you produce an excess amount of hormone. There is absolutely no reason why somebody with Graves' disease should not be vaccinated. It is not a contraindication to vaccination, and I would say absolutely yes. You should be vaccinated. There's no interaction between the vaccine and Graves' disease or your thyroid function at all.
Thank you.
Just to reiterate, Paul, I mean, the British Thyroid Foundation actually back that sort of answer up as well. They actually say it's safe to have the vaccine as well in those conditions.
Thank you, Gassan. And then there was one more question that came in advance. What about the data on the safety of giving the vaccine to someone who is suppressing their immune system with prescription medication? So is it safe to have the vaccine if you're on immune suppressing medication?
Yeah, so that's a good question. There is absolutely no evidence that it's not safe. So from a safety perspective, yes, even if you're taking immunosuppressants, sometimes even very strong immunosuppressants, vaccination is safe, partly because none of the vaccines contain any live replicating virus, which means the vaccines cannot infect you at all. So even if your immune system is suppressed, there is no risk that the vaccine will cause infection or cause harm in that respect. Some people, if they take very powerful immunosuppressants, we might expect that their response to the vaccine is not quite as good. They might not produce quite as many antibodies, and therefore they might not gain quite as much protection as somebody who wasn't taking powerful immunosuppressants. But that's not a reason not to have the vaccine. You certainly should have the vaccine to get as much protection as you possibly can. And one could even argue that if you are immunosuppressed, your risk, if you were to catch COVID, of severe illness may be much worse. So it is very important that even if you're immunosuppressed, you do get vaccinated. If you are taking very strong immunosuppressants, often these are prescribed by hospitals only, and sometimes immunosuppressants are given through a line, a plastic line that goes into your veins, into your bloodstream, and you may be visiting a hospital periodically every 2 or 3 months to have these immunosuppressants. It's worth having a chat to your doctor, to your specialist team, because the timing of vaccination could then be important, because you may want to time the vaccination at the point at which your immune system is most strong, so that you get the best response you can, rather than having it just after you've given yourself a big dose of immunosuppressant and your immune system's weak and therefore your response might not be as good. But there's absolutely no problem from a safety perspective in having the vaccine if you're taking immunosuppressants.
Thank you. And Gassan, have you anything to add on that? No.
No, perfect.
Thank you.
I'm glad you're marking me.
Thank you. And that closes all the questions we'd had in advance. And Sudesh has raised an interesting point, because he said it looks like there are some vaccination policies coming through that will discriminate against those who may refuse the vaccine. He hasn't outlined what they are. He said there's one that has come through because he works in a care home, pressure subtly mounting. So, and I guess there's other things too I can think of in terms of airlines permitting people on to travel, travel restrictions, or being limited by the vaccine. And I guess it's just reflecting. He said, "Is that fair?" I guess in a way it's not our place to be able to judge is it fair, but it may be helpful to think about why they might be in place, some of those policies from a medical perspective, isn't it, and health perspective.
And I think, like you said, going forward in terms of, for example, travel, they'll be dictated by the rules of the countries that we're going to be visiting. So with whatever the foreign policy updates will be, from those countries in terms of what is required for them. We already have vaccinations for other diseases or other for other reasons. So if you have, some countries require a yellow fever certificate, for example, or you have to take you have to have certain injections to travel to other countries. So whether this becomes a routine measure for travel, we may have to wait and see for depending on localized outbreaks, depending on what the global outcome is for the virus. In terms of workplace, that again, I mean, some of us may have heard that, and I think the most recent example I can come up with is Pimlico plumbers, who have put it into their they've decided that they would like all their staff to have vaccines going forward. Whether these policies are fair or whether they are discriminating against any individuals or groups of individuals, I couldn't comment because I haven't actually seen the individual policies, but it would obviously all be on I mean, I'm sure the legal formalities would be followed, but if they are challenged, then that's another issue altogether. I have to apologize, Sudesh. I haven't seen a policy around the care homes, for example. Paul, maybe you've seen something?
No, I haven't seen anything specific, and I think, Sudesh, your question is a good one and is a pertinent one, and it crosses into the realm of politics clearly, and actually it's not totally inappropriate to comment on that, because the whole pandemic has been partly a balance between the science and the politics. And every week we've gone and we watched Professor Chris Whitty and Boris Johnson stand side by side, and we know that there's a scientific aspect to the pandemic, and then there's a political aspect to the pandemic, and they are actually intertwined. And here in this case, you've got essentially people's personal freedom, which we value highly in a democratic country, and we believe people should be free to make the choices that they want to make for themselves, and that applies to whether you get vaccinated or not, as I've described before. But equally, we need to balance that against the health of the public and the health of society, and sometimes there's a conflict between those two things. And this is one example where there potentially is a conflict between people's personal freedom and the health of society. And if politicians at the time decide that actually we're not willing to compromise the health of society in order to enable or facilitate absolute personal freedom, and we're going to place some restrictions for the benefit of the greater good, then that's the political decision that tends to be taken in a democratic country. And I would just give one other example in the healthcare environment, and that's around hepatitis B vaccination, for example. So hepatitis B is a virus that's transmitted in blood and bodily fluids, and there are certain roles and jobs that you cannot perform in the healthcare sector unless you are vaccinated and have protection against hepatitis B. Now, people are entitled to say, I don't want to be vaccinated, but their freedom then to take up the roles that they may want to perform is curtailed because of the risk to patients that they may pass hepatitis B on if they don't have protection. So, it's a good question, and there are political elements to the pandemic, but everybody really is doing their best ultimately in the interest of the greater good.
Thank you. Thank you very much, Paul, and thank you very much, Gassan. And I realise we have run a little bit over, but I think really good questions to be considering and discussing, and really hope that the information that we've given here tonight will be helpful for you to be able to make an informed decision, both for yourself, and we realise some of you may also be talking to your peers as well, and hope this helps to dispel some information that may not be accurate, and as I said, give you sort of facts to be able to make your decision or to support your colleagues. If you do wish to have the vaccine, I should have had this in here already. There's for care home staff, you can just email carehome.covidvaccine@swlondon.nhs.uk. I'm going to type that in. I'm going to attempt to type and talk at the same time. For those of you who are working in social care, you should have either received a letter of eligibility from your employer, which will give you all of the details. If you still haven't received that, we do still have the thank you, Anka. Thank you, Paul. We do still have the home care email is still functioning and it is still running, so we can still give you that. That'll be open for another week or so, so you can still get that access if you're working for domiciliary care or social care and haven't had the letter of eligibility from your employer. And yeah, Dave, thanks very much. He's popped the forms in there too. We've moved on to, it doesn't just have to be an email, it can also be the form. So thank you very much. Huge thank you to Gassan and huge thank you to Paul for joining us this evening, and to Erik as well for sharing your story. Really powerful story, and really illustrates just how severe and how dangerous COVID can be. And we wish you well on your continuing your journey of recovery, Erik. It's been a long, hard road, and I'm sure there's time ahead of you as well. And thank you to everyone who's joined us tonight, and hope you found it helpful and informative. So please stay safe and stay well, and we look forward to seeing you in the future.
Thanks very much indeed, Vicky. Thanks, Gassan. Thanks everybody for joining, and thanks for all the hard work that you do, as I say, supporting our most vulnerable residents in South West London. I have huge admiration for you all.
Yeah, thank you for organising. Yeah, thank you for everyone for what you're doing out there. Thank you.
Thank you. And thank you, Jiggy, for your organisation. Thank you.